So we've known for some time now that circulating tumor cells are present at all stages over the myeloma disease continuum, and we know that CTC levels increase as you go from MGUS to smoldering to multiple myeloma. And we also understand now that high levels of CTCs is associated with worse progression-free survival as well as worse overall survival. So large-scale next-gen flow studies have really been pivotal for understanding the prognostic value of CTCs. But now we're really looking at trying to move forward past enumeration of CTCs and how we can molecularly characterize CTCs. So at ACR this year, you'll see my colleague, Dr. Dana, presenting on whole genome sequencing of CTCs, and you'll see me presenting on RNA profiling of CTCs. And in this study, we did single-cell RNA sequencing and single-cell BCR sequencing on 44 patients across the disease continuum from MGUS to smoldering to myeloma, in addition to 12 healthy donors. And in the study, you'll see us show sequencing-based enumeration, where we see an increase in frequency from MGUS to multiple myeloma, which is what you also see in next-gen flow data, but it's really nice to also see a sequencing output enumeration strategy. And in addition, we'll also see how we can use expression profiles in CTCs to actually infer translocations. And lastly, you'll see transcriptional differences between CTCs and bone marrow tumor cells. So we know from single-cell studies and bulk studies that on the DNA and RNA level that CTCs really are a very nice biomarker, or surrogate biomarker for bone marrow tumor cells. And now we're really looking at how CTCs are very different than multiple myeloma cells and how they're very different from normal circulating plasma cells. And now looking at single-cell resolution, we're really able to look at a CTC signature and what is that high-risk CTC signature to kind of complement the enumeration data that's been published to date.